If we talk about hemophilia, hemophilia is like a genetic disorder in which genes are at fault, and are coagulation factors like the chemicals which causes blood to coagulate, or uh, blood is actually the clot is formed. So
Right.
those chemicals are missing, they don't form. So these deficiencies, they cause blood not to clot, so they bleed a lot. On minor trauma only, these patients, they bleed like anything. So in hemophilia, we treat them for these with the clotting factors and other things, and we need to be very careful they don't get traumatized. So these kind of patients, they are at risk of severe bleeding, spontaneous bleeding also. So this is hemophilia. Leukemia is a disease of bone marrow where your blood cells are not forming accurately, so they don't mature, and those immature cells which gets matured and give you normal blood, they actually have some fault in themselves, and normal blood does not form, only cancerous cells are forming. So red blood cells, white blood cells, and platelets, they are all depleted. So when platelets are low, you get bleeding. When red blood cells are not there, you get anemia, breathing difficulty, no oxygen is there in the blood. When you don't have white blood cells, then you don't have any immunity, defense system is weak, you catch infections. So this is leukemia. Lymphoma is again the lymph glands, they actually are involved in lymphoma, and it is a cancer of lymph nodes only. It can happen anywhere in the body, in your neck, in your armpits, in your groin, in your abdomen. So these lymphoma, whatever group is involved, uh, so you can get Hodgkin's or non-Hodgkin's lymphoma. Myeloma is again a disease of bone marrow, where these some kind of plasma cells are there. So plasma cells are nothing but they are immune system cells which gets increased. Normally they are less than 1 or 2%, but in this disorder they are beyond 20%, 60%, 70%, and they secrete proteins. So abnormal amount of large protein is there in our blood, which causes blood to get thickened. Other things are four main things are there in myeloma. One is kidney gets affected because of the protein deposition. So kidney uh, failure is there. Second is these cells which are there in bone. One type of cells, they actually causes bone to resorb. They eat bone. Second kind of cells are they actually deposit calcium on those. So there is usually a balance in normal life. But when myeloma is there, these osteoclasts or bone eating cells, they gets activated and they actually harm your bones. So bones gets fractured. Second thing. Third thing is calcium levels are very high. One is bone, renal disorder, calcium levels, and anemia. Hemoglobin, because blood is not forming, then anemia is there. So these four things are there, and this is usually a disease of the elderly people, more than 60 years of age.